So welcome to today's podcast here at the Flower Empowered. I would like to welcome Dr. Bree, and maybe everybody already knows her from Fem Fusion Fitness, which is one of the YouTube channels that you will find in my subscriber list. I have been subscribed to Dr. Bree for quite a few years now, as I'm sure many of you are, and maybe you've seen the wonderful content. I mean, it's hundreds of videos. So also she's the author of the Lady Bits, which is a fantastic book. Look, it's quite a substantial book as well. It's weighty. And she has many different programs. She is a doctor of physical therapy, and she's got many different programs that help with conditions that have hypertonicity, so pelvic pain, vaginismus, prostatitis, those types of things, and also incontinence and prolapse. But without further ado, I'd like to just say welcome, Dr. Bree. How are you today?
I'm wonderful. Thank you for having me. And Denise, I have to say, your channel is one of the featured channels on my YouTube channel as well, because I love the work you do. And you were on my podcast. So I have the book called I have the book called Lady Bits. And then I have a podcast, which is just audio only, but that's called Dr. Bree Talks Lady Bits. And Denise, your episode, I think you actually have two on there. We had a two-parter, I believe. Yeah. And they are some of my most popular, most listened to episodes. So thank you. Yes, people, my people love you. So.
Yeah, and I think my people love you too as well. Quite a few people send me messages and say, I got this one from Dr. Bree. So
nice, great, yes, love it.
So I know you obviously have lots of courses available, and you do so many different things. I mean, you were an inspiration to me when I was dealing with my own pelvic floor dysfunction, and I used your YouTube videos when I was starting out and trying to kind of get to grips after my own mesh removal surgery. So absolutely invaluable. But maybe could we start to talk? I know a lot of the people that come to my channel have problems with hypertonicity and pelvic pain, and I know that that's a really strong area for you. You have the Overcome program. Could you maybe tell us a little bit about that?
Yeah, I'd love to tell you about that. And just for anybody listening as well, I do have actually over 600 free videos on YouTube as well. So there's everything that I will share today. I have free stuff on YouTube that you can access. But what I've learned over the years is that people often want a little bit more higher level of help. And they also want things put together all in one place, like for example, in a book or in a course. And so I really discovered that I enjoy making courses and putting things together. And I love making videos. So I like putting things together in video format in courses. So I created a course called Overcome, which is a guided 12-week course. And I have a version for men and also a version for women, because although there's so many similarities, but there are also some definite differences between men and women who have pelvic pain and tension issues. And so that course actually came about because one of the men who had benefited from my free videos on YouTube for pelvic pain and tension, his name's Michael. He reached out to me, and I reached out to him for an interview on my YouTube channel, and we did an interview just because he's somebody who'd commented, just left some comments that were very kind and well thought out, what he said and all that. So I said, hey, will you be on my YouTube channel? I would like to interview a real pelvic pain person, like someone who's going through it. And so we did that interview, and gosh, at least a year, maybe even 2 years later, he contacted me completely out of the blue and said, you know what, like I'm completely cured, like no issues, no problems. I would love to make a course with you, because he also creates courses for martial arts. So he and I collaborated, and that's why we came up with Overcome Pelvic Pain for Men actually first.
Fantastic.
And so we created that, we released that program, got great feedback from it. And we decided to make a version for women as well. So I believe that pretty much anybody can benefit from learning how to release and relax the pelvic floor muscles.
Yeah.
So I think that Overcome is a wonderful program. I mean, definitely for people, it's designed for people with pain issues and tension, which can come from a number of different sources for men and women. But I honestly think that everybody could benefit from just learning how to let go first. So if somebody was curious about like where to start with my programs or with anybody's programs, I would say if you're looking for like a guided course and you think you have any issues with tension, or if you have any pain, definitely overcome. Or on my YouTube channel, I have a whole playlist that's titled Pelvic Pain/Tension. And there's just a ton of videos and meditations in there that can help you learn how to let go, because you have to learn how to let go before you can strengthen, before you can be successful with building up any strength at all. So that's my soapbox.
Yeah, and your meditations are really good as well, and
Oh,
that's,
thank
I
you.
think that's one of the key things. We have to let go of tension, but we also have to let go of all these things that are all of the little monkeys in our minds that are getting in the way and helping to place that physical tension into the body in the first place.
Oh, exactly. And actually, what you say is so true. And I was just, really, I've been coming to understand that the only way to really make change is for your body to begin to start feeling safe. Your body has to feel safe in order for any change to take place. And if we're talking about anything from, a health change to even something like just installing new belief systems for success, whether you're manifesting, a success in your career or a new house or a love relationship or whatever it may be, for any change to take place, you've got to feel safe. Your nervous system has to calm down.
Yeah.
And I've really found this to be true with physical health, but of course the mental, the mental stuff too.
Yeah. And for those that are suffering with overactive bladder, for example, that's one of the key things. When you feel the bladder urgency, you have to get that, you have to tell your nervous system that everything is okay. So you have to actually get the thoughts going in the right direction, as well as trying to release the physical tension from the body.
Yes, absolutely. That I always call that riding the wave. Like you when you have overactive bladder, you tend to want to use the bathroom at the height of urgency because of course you're like, oh my God, oh. And so you're up here, but your stress level is also up here. So everything is just amped up, and it's so much more helpful. And part of bladder training is to, which I know you cover all of this. I know, Denise, in your work, but it's about actually waiting and not going at that height of urgency. It's riding that wave till it subsides just a little bit. And there's some techniques and things that I'm sure you tell people about, but ways to ride that wave so that then you can calmly and slowly walk to the bathroom when it's not quite such an emergency.
Yeah.
And that, again, you're bringing safety into your system when you actually finally do go to the bathroom, so you don't start associating peeing with being like this. You associate peeing with being calm.
Exactly. And
Yeah.
the same thing goes for defecation. Maybe I've told you about my poo songs where I replace
No.
the words. Yeah, to try and prevent, if you have a hypertonic pelvic floor, or some dyssynergia where you need to relax, but instead you're contracting, or the nervous system is still holding on. One way to distract from that is to sing a poo song, and that also balances intra-abdominal pressure. So I tend to replace the words in a normal song with the word poo. So I wouldn't say I love you, I would say I love poo, and I would sing a little song, and it makes me feel a little lighter, and it's not as stressful, and I think that helps.
This is fabulous. And I'm thinking too, there's so many ways this could go, because also the lower the register of your voice, it kind of tends to relax your pelvic floor. So maybe it could be kind of a low, throaty poo song, like I love poo. Yeah, you can really lower that tone a little bit and get the.
Maybe we should recruit some people to try singing at different pitches, and we see if we can find the perfect pitch for the perfect poo.
I think that's amazing. Let's do it. That's the next project. That's the next course, right?
Yeah, I think the life is not so serious, and these conditions feel very serious. And that's the thing about, your meditations kind of help to take you to a calm and centered place. And like the amount of content that you have on your channel, it astounds me. I don't know how you managed to create so much.
I am a content creation machine. And I think it's just because I always wanted to be an artist when I was growing up. Like that was my dream, was to be my dream was to be a fashion designer, which is funny. If you were to look at my clothing now, all I wear is yoga pants and sweatshirts, most of the day. So,
but they are very fashionable yoga pants and sweatshirts.
Very fashionable yoga pants. Yes, I do like me some leopard print, but no, I wanted to be a fashion designer, and I was always drawing and creating wardrobes. The funny thing is I was always creating wardrobes when I was a child.
Okay.
And I think it's really amusing because now I've created, like I drew the perfect pieces in the perfect closet for a vacation to Hawaii, or for this or for that. I'd line up and kind of what's the word, curate like the ideal wardrobe. And now I feel like I try to do that with my videos. I create these videos and I try to kind of curate this content that's creative, and it sort of like hits all the pieces. So I use my creativity for fitness now instead of drawing outfits, but it's still very creative, and I just can't stop that monkey brain. It's always going and coming up with new fun things.
Yeah, and I mean, I think one of the really wonderful things about how well you've curated it is that, as you say, like, I mean, there's a huge amount of free content there, but regardless of which condition, which pelvic floor dysfunction you have, there's something there on your channel. I mean, I've watched some of the videos on building strength. I think the latest one this week, you were doing like standing with your weights, and taking it to the next level.
Yeah, I love that one. And that's so I do have a variety, and that's actually the hard thing about YouTube. I will say is that you don't know who's watching.
Yeah.
And you know, I'm not there, like it's tough because I'll have so many people say, is this appropriate for diastasis recti or prolapse or whatever, you know, pelvic tension, pain. And it's like, well, I'm not with you right now. So
Yeah.
I'm putting out content. And it's like, I do my best to describe who it's going to be for, especially in my newer videos within the last 3 to 4 years. Some of my older videos are a little, it's not that they're questionable. It's just that a long time ago, I was really just putting out general core fitness. It really wasn't designed specifically with prolapse in mind. I always addressed the pelvic floor and pelvic health just in general, but I really didn't focus on working with people with pelvic pain and tension. That's kind of my one path that I work with. And then prolapse and bladder leakage is kind of my other paths that I work with. I really didn't, I just didn't, I don't know, like I didn't really think about it that much at that time, even though, because I was just putting up fitness videos thinking that I was going to be a fitness YouTuber. But then when I realized there was such a need for these conditions, I really decided to tailor my content. And so unfortunately with YouTube, I still can't, I don't know who's watching what. And I just hope everyone's staying safe and following the directions and listening to their body and tuning in. But that's why the courses are so nice, because they can be a little more tailored to, okay, if you have pelvic pain, this is the path you need to go overcome. If you have prolapse and bladder leakage and you're ready, you're beyond the pelvic pain, you're beyond that excessive tension, then go this path, my lift program, because then you know it's tailored to prolapse, it's tailored to your needs, and you know you're getting the right content for you.
Yeah. And that's the thing, if you give with these programs, you're giving the structure, because it's probably the most common question. Where do I start? What should I do next? You know, and that's the not really nice thing about a program, is that it gives you a path that you can actually follow, and also the ability to regress, because people always think about the path forward, but the journey to, you know, from where you are to where you want to go is never a straight line. It's always up and down and all over the place.
It's so great that you bring that up. And actually, I thought of that in both of my main programs. So the Overcome program, it's 12 weeks, so 3 months. And at the end of each month, we actually have a questionnaire, like a quiz, basically, that basically you do a baseline questionnaire. So you find out where you are at the beginning of your journey. And then at the end of each month, you take it again. And then you're able to compare your results from baseline to the end of month 1. And if they have not improved a certain amount, we really encourage that you not move forward. Like you're not ready. And so then, you know, we have you go back a couple of weeks and, you know, redo them and then take the questionnaire again. And then if you're ready, you can move forward. So I really hope that people, you know, I know that some people do take advantage of this questionnaire. I know not everybody does, but it's there for a reason, because some people aren't ready to move forward yet. And in my lift program, which is the one for prolapse and bladder leakage, I really encourage people, because a lot of people actually benefit tremendously from week 1, which is primarily about identifying the pelvic floor and learning how to let go, like learning how to release.
And it's the first step, right?
First step. And so there is some gentle core strengthening, but it's not too hardcore. And so I really encourage people, if you feel that you need to stay on week 1 for 2 or even 3 weeks, do it. Because a lot of people will find that they go on to week 2 of my lift program. And even though it's gentle exercises, but it's still just a little bit too much. And they still are dealing with tension because so many people don't realize how much tension they're holding in their pelvic floor.
Yeah.
So, I mean, my main takeaway with this topic is that if you are doing exercise, strengthening exercises, and you feel like your problem just keeps getting worse and not better, that means you're not ready. You need to back off. It doesn't mean push harder.
Yeah.
It doesn't mean push through. It means stop and modify.
Mm-hmm. And that's it. I think it's one of the hardest things for people to do, because it's like the journey to touch your toes in yoga. Everybody just wants to get there.
Yeah.
But to get there, you actually have to move slowly and carefully. And when it comes to the pelvic floor, as you know, most pelvic floors have some hypertonicity and some laxity. So you have to deal always with the tension first. Take tension out of the system before you work to kind of balance with increasing strength.
Yep, exactly. And I think that that's something that when I was going through, I mean, it's been a long time since I went through my training to specialize in women's health physical therapy. It was 13 years ago, to be honest.
Wow.
I'm like, when I look back, I'm like, it's been that long, but it has. And I'm dating myself here, but 14 years ago, when I was going through this, I feel like we definitely talked about hypertonicity and laxity and the need for strengthening. And we talked about, of course, you need to release first. Like we talked about all of this, but I feel like the hypertonicity was a little bit glossed over. I don't think it was addressed as much as we're realizing now it should have been. And so I think a lot of people 13 years ago, and when I was clinically treating patients, I definitely released a lot of pelvic floors and I definitely treated a lot of pelvic pain in that way. But I also probably gave a lot of Kegel exercises to people who probably shouldn't have gotten them.
Yeah.
You know?
And that's, I think the approach to pelvic health has shifted in the last couple of years. I mean, there has definitely been the old treatment would have just been, 3 sets of 10 every day. Or, I mean, I've even heard some like do 500 Kegels a day. That's a huge amount of repetitions, and maybe maybe that's going to exacerbate whatever issue is already there. I like the approach of taking the tension away, and I love that's how you approach it as well. You start by you have to get the nervous system to relax. I mean, at the end of the day, all movement is just communication with the nervous system.
Yes. You stated it so brilliantly with the brain being the CEO of the body. And I'd heard that before, but you really say it really clearly on the podcast. And I loved that. It was such a great analogy that you shared with my audience. So
yeah, that's kind of a little bit of the foundation from my own book. It's trying to approach things more from an engineer's point of view, because that was my background. I was an engineer before I had to deal with all of the pelvic floor stuff. But tell me a little bit more maybe about the LIFT program. I know that you're focusing there on prolapse, also I think incontinence, right?
Yep. Yeah. So LIFT is a great program for anyone who has, again, prolapse or bladder leakage, any type of condition where they feel like it's time to start strengthening and toning things up. Now, toning things up, that actually sounds wrong because we don't want too much tone, but you know what I mean. We're looking for somebody who's ready to develop that supple resiliency in their pelvic floor because they're having some leakage or they're having some heaviness or dragging in their pelvis. Maybe they've been diagnosed with a mild prolapse, something like that. So of course, I recommend for all of my programs that if people can work with a physio one-on-one with an actual physio in person, that is ideal because nothing can replace being seen by somebody one-on-one and getting an internal examination and that kind of thing. So that's the caveat to all of my programs and to my free videos on YouTube as well.
Yeah,
for sure. But this is not a replacement, but it's a nice at-home option. And especially I've found in this time of history with a lot of us being at home more and harder to get appointments out and about, that it's really nice to have an option that you can do from home. So LIFT is for those people who are ready for that. And it is 5 weeks. It's a 5-week guided program. But like I said, you can take as long as you want with it. Some people like to repeat week 1 for 2 or 3 weeks or even week 2 or whatever. It can be drawn out as long as you want. And it's really awesome. I love it because I think that I am such a strong believer in first the power of release, like we've been talking about, but secondly, the power of lifestyle, you do your pelvic floor exercises or your core workout, or even, you go for an hour at the gym or an hour long walk or something like that. But that's really a fraction of your day. It's what you do in the remaining 90 to 99% of your day that really matters and what makes a difference as far as your pelvic health. And with prolapse, particularly, which is such an issue of pressure management. That's such a big, big issue in prolapse, is you're not managing pressures correctly in your intra-abdominal area. And there's so many reasons for that, which we don't need to get into today. But a lot of that is how you're living your life, how you're breathing, how your posture is, how you're sitting and standing, how you're transitioning between sit and stand, how you're lifting things, how you're even bending down to pick up a pencil off the floor, or your dog or your cat or your kid or whatever.
Yeah.
Like, all day long, we're doing things that can hurt or help our pelvic floor, like depending on how we're doing it, how we're pooping, how we're peeing, like all of these things really matter. And so the foundation of Lift is lifestyle.
Yeah.
And so it's teaching people every week there's new exercises, which again start with, very gradual. And so there's new exercises, and there's an instructional video that takes you through exactly how to do each exercise and the lifestyle tips for that week. And then the cool thing is that instructional video is about 45 minutes long. So I really get into it because I want people to do it safely.
Yeah.
But I know that not everyone's going to watch a 45-minute video every day. And so, no, who's going to do that? And so I condense the exercises for that particular week into a 10-minute, what I call a flow through routine. So it's just 10 minutes, no talking. It's just music. And I've selected music that I like. I think it's really powerful music. It's calm, but it's also kind of inspiring. And I go through the exercises pretty, slow and controlled, but at the same time, it still only takes about 10 minutes to do the whole thing.
That's
so that's
brilliant.
the daily routine. Yeah. But then again, like I said, that's 10 minutes. You've got the rest of your day. So that's where you really need to focus on the lifestyle, and Lift takes you through. It breaks up like this whole plethora of lifestyle things that you need to be thinking about. And it gives you a couple things to think about each week. So that's the whole thing. And then the cherry on top of the whole pyramid. So we have lifestyle at the bottom, and then the exercises, and the little cherry on top of the pyramid is mindset. So I do have a whole section dedicated to meditations, affirmations. Some people would consider it like fluff. I consider it that actually maybe my pyramid is reversed at this point, just because I believe so strongly in the power of mindset.
Yes.
So I've got the lifestyle and exercise under control. And now my main focus with my own health is mindset. It's huge in my own life, and it's been the biggest needle mover. So it just kind of depends on where you're coming from. I think for people just starting out, focusing on the lifestyle and exercise is awesome. And Lift will do that. But for those who are interested and open to the mindset piece, it's there too.
I actually think that that's the most critical piece for me. In the book, actually, that's what I go through. I mean, you have to start with the mind. What you think, we talked about this on the podcast I did with you, what you think, it impacts what you manifest in your body. So
absolutely.
So what you place tension in your tissues just by your thoughts. And if you get your mindset right, then you can really achieve really great things. You can even visualize. I know you like the visualization as well. I can visualize yourself in a better place. Yes. And that helps, that lets your nervous system know you can get there.
Yes, absolutely. Yeah. The meditations that I offer a lot of them focus on relaxing the body. So relaxing pelvic tension, sort of guided visualizations that help get you there using guided imagery. And then I do actually have some fun meditations that actually make you feel as if it guides you through actually lifting your organs, healing your tissues, like these beautiful images that really almost take you into a trance-like state. Again, if you're open to it.
Yeah, that's why I think that's
for everyone, but it's really cool because it actually, you can create healing in your body just by using the power of your mind.
Yeah, and if you look at the scientific backing for that,
Mhm.
there is that study where they strapped up the wrists of two different groups. So one group was allowed to do wrist exercises. One group had their wrist strapped, but had to imagine those exercises. And the last group was the control group. So the wrist was strapped, but they didn't have to imagine anything. And at the end of that study, the group that had the wrist strapped and they didn't do any exercises actually lost muscle. The groups who did the exercises gained muscle, and so did the group that imagined exercises. Doesn't that just blow your mind?
It blows my mind. It's so powerful.
Yeah.
It's absolutely powerful. And a study that I love that I think is really powerful, kind of sort of just relating to how the mind affects the body, is one that really shows how our pelvic floor is a muscle of emotion. Like it is an emotional muscle, just like we all we take for granted that our shoulders tense up when we're under stress, or if there's anything freaky in our lives, right? But we don't think of our pelvic floor. But there's a study that found that actually when exposed to 4 different movies, so just, one was, I think, just a neutral kind of regular calm movie, something like that.
Mhm.
One was an anxiety provoking situation. One was a sexually threatening situation. So two bad ones, a neutral one. And then one was a good one. It was like a pleasurably romantic one. So those 4 different movies, and it was a decent sized group. I can't recall, maybe about 30 people or so, but they hooked them up to EMG in their shoulder, like upper trap area,
Mhm.
and then also their pelvic floor. So to see what the muscular activity was in these areas. And they found that the pelvic floor muscles actually reacted more strongly to the stress of the stressful movies. So they actually were more activated with those stressful, anxiety provoking situations.
Yeah.
And I just think that's so fascinating because, like I said, we don't think about the pelvic floor as doing that, but we think about our shoulders. Oh, my shoulders are so tense, they're up in knots because I'm stressed.
Yeah.
Well, what the heck is your pelvic floor doing? So again, it's there again, just the power of mindset and calming mind and body
Mhm.
for helping your pelvic health
And
as
that's
well as.
really, really important for people with vaginismus. I know there's quite a few people that come to my channel, and I'm sure also yours, that are suffering from vaginismus. So
Mhm.
this is a really good study for them to know about. It might even help. I mean, with these kinds of meditations, you have some specifically for getting rid of tension in the pelvis. I assume you do.
I do. I have one on my YouTube channel. It's called Guided Meditation for Pelvic Floor Relaxation, something like that.
We can put a link to that one in the show
Yeah.
notes. Yeah.
Absolutely. And then and then I have a meditation for letting go. So I have several meditations on my YouTube channel, and then I have meditations in my courses as well that are not on YouTube.
Yeah,
So
and I think it's really, really important for people that are having particularly issues with tension. Really
yeah,
important. Even if it feels like it's a little airy fairy with meditation, it really can make the difference between the ability to let go and letting go of emotional tension and the holding on of that
absolutely.
tension.
Yeah. Yep. And so that's why I've included them in the Lift program, but also I just wanted to insert there that they're also in every month of my Overcome program. We have, for the Overcome program, the pelvic pain and tension program for men and for women in both situations. Each month we have, there's a new weekly set of stretches each week. And then each month there is a new mindset practice, a new deep relaxation pose, which comes with kind of a short guided meditation, and then trigger point release work as well. So
Oh,
it's very inclusive with fresh things each month for that route. So yeah, it's foundational, this stuff.
that's
Mhm.
it's fantastic. I mean, invaluable resources. And I'm going to put a link to your book and also to your courses in the show notes. But this has been really fantastic. Absolutely, I love talking to you.
I love talking to you, and I'll be talking to you again soon, Denise, when you have more news about your book and stuff.
Yeah, I look forward to that. Is there anything new coming? Have you anything kind of exciting to report over the coming months? Any?
Well, yeah, I mean, there's always something new and fun coming up in my world. I have new videos every week on YouTube. I mean, I don't know if that will last forever, but at least for now, for the foreseeable future, there's at least one new video each week, usually fitness related. And one thing that I think I really take pride in is I make my videos full length. So they're full on, you can get a workout in. It's not,
Yeah.
I think sometimes some people just maybe do like one exercise or something like that. And I try to make it a fun routine. So that's every week. And then I also offer a high-level coaching program called Transcend, which is all about the mind-body connection. It's really meant for people who've been through one of my foundational programs like Overcome or Lift. And I have a waiting list for that. If anyone's interested, perhaps I can give you the link for that as well. But I only offer that once a year. So that's coming down the pipeline as well.
Fantastic. Oh, wonderful. Well, and listen, thank you so much for joining me today.
Oh, thank you.
I wish you a really wonderful rest of February, and I hope it's spring where you are.
It's beautiful right now, but we'll see. Tomorrow it's supposed to rain again. So it's okay. We take what we can.
Yeah.
We are grateful for every sunny day.
Okay. Thank you so much.
Thanks, Denise.